Good afternoon, everyone. A very warm welcome today. Thank you for joining the webinar on a very important topic, which is also coinciding with World Sleep Day. I'm Mai from Prudent Insurance Brokers, and I will be moderating the session today. Sleep accounts for 1/4 to 1/3 of the human lifespan. But what exactly happens when you sleep? Before the 1950s, it was believed that sleep was a passive activity during which the body and the brain were dormant. But it turns out that sleep is a period during which the brain is engaged in several activities which are necessary to life. Sleep plays a vital role in good health and well-being throughout your life. The way you feel right now would be directly correlated to how you slept last night. So sleep is an essential function that allows your body and mind to recharge, leaving you refreshed and alert when you wake up. Healthy sleep also helps the body remain healthy and stave off diseases. Without enough sleep, the brain cannot function properly. This can impair your abilities to concentrate, think clearly, and process memories. To understand that deeper, I have with me an expert, Dr. Satish Ramaya. Dr. Satish is currently the medical director of Marga, unit of People Tree Hospitals, super specialty psychiatry hospital in Bengaluru. He graduated from Bangalore Medical College and Research Institute. He then completed his MRC post-graduation in psychiatry and specialist training in various subspecialties of psychiatry with advanced training expertise in addiction disorders from University of Leeds and sleep disorders from University of Edinburgh. He has a specialist endorsement in liaison psychiatry by Royal College of Psychiatrists UK. He has been the lead consultant for neuropsychiatry services for the Cambian Group, which is the largest private mental health services provider in the UK, and has consultant experience in NHS Sheffield. He has special interest in psychiatric disorders, in physical illness, and integrated psychotherapies. He has research publications in the field of addiction, learning disabilities, and sleep disorders. So I can guarantee that we all are in very good hands today with Dr. Satish. So a very warm welcome to you, Dr. Satish.
Thank you very much, Mai. Thank you for a wonderful introduction. You also gave a perfect foundation talking about the necessity for sleep, the importance of sleep on the special occasion of the World Sleep Day. Thank you very much. So can I go ahead now?
Yes, please.
Great. Hi, good afternoon, everyone. So as Mai introduced, I'm a sleep disorder specialist. So as you will imagine, my primary job is to put people to sleep, make sure people sleep well. And I hope I don't do that this afternoon. So I really wanted to be an interactive session because we're talking about an extremely important physiological activity. Yes, of course, there are a lot other underlying factors associated with this physiological activity, but I think it's an important aspect of our life where we need to know a little more about what we already know and see how we can bring about some positive changes to make things better. So let me just try and move my slide. Let's make sure it works. Yeah. Now, sleep is in the news all the time. This is one area where people don't hesitate to talk about. Now, if you open any magazine or any newspaper, at least you'll find one article about sleep, at least, in a week. So such is the importance of sleep, and such is the importance people give to sleep in terms of they openly talk about it, discuss about it, want to know more about it, and yet do we know fully about it in terms of making things better for ourselves. So let's try and spend about half an hour, 40 minutes to understand the basics of sleep, the normal sleep, what are the common concerns about sleep people have, and how do we overcome it, and a little bit about the physiology and what actually goes on in the background. Like Mai said, few decades ago, it was thought that everything rests when we sleep. Our mind, our body, and all the organs, including the brain, takes rest. But that's not the case. It's almost like a thinking in a different biochemical state. Thinking and all the other activities are happening, but in a different biological setup. So let's try and understand a little detail about it. So sleep is quite enigmatic. It is a very complex psychophysiological system. There are so many factors associated, to make things better for your sleep in terms of It can be directly related to your physiological state, your psychological state, sometimes your personality, your coping skills, the kind of things you're dealing with in life in terms of relationships or career and so on. So there are so many underlying factors which contribute to how you sleep. Yes, it is enigmatic, but at the same time, we all know it is extremely essential. It's very rejuvenating, refreshing, and probably the most important hallmark of well-being. So of course, there are many other hallmarks we talk about in terms of how we measure our well-being, but sleep, I think, is the most important one. Now, you might all be wondering in terms of why I have put up this slide here. So these are some of the major disasters that humankind has seen. The 3 Mile Island, the Chernobyl, our own Bhopal gas tragedy, Exxon Valdez in '89. Now, if you actually look at the reason for some of these major disasters, which has been affecting not just few people, few thousands of people, but generations together. If you actually look at the causes of these major disasters, it's been attributed to a human error. And if you further look into the further attribution in terms of why that human would have made a mistake that particular day or night causing this disaster, it's further attributed to his or her sleep problem. Of course, it may not have been established well, but certainly could be a major factor in terms of why this person led himself to make this mistake and caused huge disasters in these places. So such is the magnitude of problem that can result in if you don't sleep well. Of course, we don't see that often. We don't see it every day. We don't see disasters every day. So there are many other consequences that can happen if you don't sleep well. When your sleep is disrupted, many things can change. Like I mentioned, yes, you may wake up feeling a little groggy, tired, irritable, drowsy. I think that's quite often. We all go through that, I think. It doesn't mean that all of us are suffering from insomnia. I think a couple of nights you don't sleep well, the following day you may wake up feeling very drowsy and groggy. And yes, it does affect your performance, your motivation, and all that. So first, let's look at the consequences of not sleeping well or lack of sleep. So short-term consequences, I'm sure you all experience that. It affects our cognition in many ways. It affects our concentration, our judgment, our ability to learn and retain information, and also may increase the risk of serious injuries and accidents. And we all know at what time the major road traffic accidents happen on the highways particularly. And we know it's early hours of morning. And there are many reasons for that. Yes, people will be very sleepy, or maybe deprivation of sleep the entire night would have resulted in the accidents. And that also there's another important aspect. And these accidents particularly happen usually in the early hours of morning. That's because that's when we're supposed to be in what we call REM sleep. REM sleep is when all the muscles lose their tone, and it almost like a paralysis. We lose, we kind of become quite relaxed. And if the driver is quite sleepy and is in a REM sleep, where his muscles lose tone, become relaxed, and that's when he may lose control on the steering and not just feeling drowsy. So there are a lot of reasons behind this. So let's dig a little deep into that and understand. And what are the long-term consequences if somebody goes on having insomnia for a long time? Yes, it can cause serious physical health problems as well. It is deemed as an independent risk factor for cardiac diseases. So independent, if all the other factors are taken into account and are perfectly fine, a person having insomnia alone can lead to increase in heart diseases. So obesity, hypertension, diabetes, including depression, it lowers your immunity levels, can lead to alcoholism, and alcoholism can further lead to depression, even the decrease in overall life expectancy. So there are a lot of physiological consequences in the long term if you don't sleep well. And psychologically, yes, like already mentioned, yes, it can lead to simple things like irritable, having poor concentration, sometimes aggression, feeling apathetic, some disorientation, including severe depression, sleepiness during the day, and even paranoia. So having consistent sleep problems for a few weeks and few nights can result in some psychotic symptoms as well. And yes, it's not just the impact in terms of the way you experience emotionally or cognitively. It also can have impact on your personal and professional life, the way you manage relationships. You're at workplace, you might become quite irritable. It may lead to quite a bit of micro sleeps, lowers your performance, impaired short-term memory, reduced communication, reduced motivation. It can even impact the morale of the workplace because one person is feeling groggy, tired, depressed, sleepy, and it can affect the team at large. So before I go further, I have some questions here I put out, and I think it will be posted in the chat box. I think I would like all of you to try and answer these questions. Very simple questions, true or false answers. So just to keep you stimulated, and the answers for these questions you should find in my talk today over the next half an hour. And towards the end, we'll have a look at the analysis of your answers, and at the same time, we'll also look at the actual answers. So I'll just put out the questions. So longer the sleep, better the health. We need to answer true or false. Elderly people should sleep more than the middle-aged people. Question 3, weight and sleep have a unique relationship. Snoring is a sign of sound sleep. True or false? Cumulative sleep in 24 hours is more important than the night sleep. So what I really mean is, it doesn't matter what time of the day and how much you sleep, as long as you get your quota of so many hours in that 24 hours. Is that good enough, or you need to sleep in one stretch? So the question says cumulative sleep in 24 hours is important than sleeping in the night. Is it true or false? Sleeping pills.
Just to announce, I can see some people commenting in the chat box, question box. In fact, there is a survey link. Just check your chat. I hope that to whoever you can access. I know some of you may not have the external websites may be blocked, but if it's not, just go ahead and take it on the Survey Monkey link that is being shared. Doc, you can continue, please.
Yeah, it'll be helpful if you answer on the Survey Monkey so that we can analyze the results. Yeah. So yeah, this question says sleeping pills are safe as long as the doses are kept low. So as long as you keep the doses low, it doesn't matter. You can carry on taking them as long as it helps. Is the question. So true or false? So alcohol in small amounts is effective in treating insomnia. True or false? Crimes can be committed in sleep disorders without awareness. True or false? Rigorous evening exercise can help you sleep better. True or false? The last question, CBT, it's called cognitive behavior therapy. Some of you may have heard about this term. It's type of psychotherapy, can help in people suffering from insomnia. True or false? So please take your time to answer these questions, but please focus on the discussions we're having. You can just answer them questions at your leisure, and towards the end we'll come back to these questions and look at the answers. Now let's start with what is sleep. Honestly, I don't think we know the entirety of why we sleep and the complete mechanism of the sleep. But so far, what we know is it's a complex phenomena in which the eyes are closed, consciousness is completely or partially suspended, muscles are relaxed, and this is repeated several times in a night. I think that's a simple definition. I think we all kind of agree with it. So there's the factors in terms of eyes closed, consciousness is completely or partially suspended. We'll talk about that when we talk about sleep cycles. And of course, muscles are relaxed. May not be in every stage of sleep, but we'll talk about it. And there's repetition of this whole process again and again in the night. And what are the functions of sleep? What does actually sleep do? There are many functions, and I can't really highlight the importance of sleep, right? Like it was, I already mentioned that we may spend about 30 to 40% of our lifetime in sleep, and it's extremely important why we do that. So what happens when you're asleep? There's a lot of conservation, regulation activity going on apart from all the cognitive functions. So this energy conservation, the temperature, body temperature goes up and down, so metabolism rate goes down, so this preservation is happening. And the whole day we've been going through all the wear and tear of whatever we're dealing with, both physically and psychologically. So all the repair and the restoring work happens in the night, the tissue repair, the muscle growth, and all that. And particularly the growth I want to highlight here. So this growth hormone surge that happens when people are in deep sleep. Slow wave cycle is what we call, is a particular stage of NREM sleep. So if you have young children at home, I'm sure you all agree that we encourage them to sleep longer and longer. It's extremely important during their growing period. They need to sleep longer. Why? Yes, one, there is a requirement. The duration should be high. We'll come to that in a minute. And secondly, that growth hormone surge happens when they are in deep sleep. The longer they sleep, longer they have the shortwave cycle sleep, the better it's for both their cognitive and physiological development. And what about the cognition? Yes, the memory consolidation happens. So when we're asleep, it enhances your performance and perception is maintained. So during sleep, there's a lot of cognitive aspects happening. So memory restoration, it moves from short-term memory to long-term memory, so that retrieval becomes easy in the future. So people having long-term sleep deprivation can have significant forgetfulness problems and early onset dementia also. Sleep also helps in relax, and also multiple hormone secretion happens during sleep. So you can see there is multiple physiological, cognitive functioning, restorative functioning. So like what previously was thought about, everything is addressed. That's not the case. It's a lot of activities are happening. A lot of most important activities are happening when we are asleep. So what I thought I'll do is, rather than just talking about the theory part of the sleep and everything, I'll quote some common concerns which I encounter as a clinician, as a sleep specialist, where people come to me with the issues, and then using those kind of concerns, I'll elaborate on the science behind it and how do we address it. So the first concern, I prefer sleeping early in the morning and waking up in the afternoon. A lot of people ask me, do I really need to sleep in the night? And I can sleep early in the morning and wake up in the afternoon. I'm perfectly fine. As some people may have been going through a lot of impact because of it, but they still continue to have a very erratic sleep pattern. So what does the science say? I'm sure you all heard about circadian rhythm. Circadian rhythm is governed by what is called a biological clock. We all have literally a clock in our hypothalamus, which regulates many things listed in this slide. Many things, our temperature or cortisol levels or mood, metabolism, blood pressure, and so on. And amongst that, sleep also through a mechanism of secretion of melatonin. And some of you may have heard about melatonin, which is a sleep hormone released in our pineal gland, so which regulates our sleep. It's a sleep hormone, sleep inducing hormone rather. And now look at this clock here. In this biological clock, in the circadian rhythm, I want you to focus on the time the melatonin secretion starts. Like I said before, it's a sleep inducing hormone. So look at this time the melatonin secretion starts. It's somewhere around, I don't know, maybe around 9 p.m., 10 p.m., or when it is totally dark. And what time does it stop? Around 6 to 7 a.m. Now look at the beauty of the nature. We all know melatonin is a sleep inducing hormone. And when does it get secreted in the body? When there is total darkness. So what is nature trying to tell us? Nature is trying to tell us that we should be sleeping in the night. That's when we get the perfect physiology, perfect sleep cycles, and perfect restorative sleep. But what do? We all may have very erratic sleep patterns, particularly young people, adolescents, night shift workers. Sometimes it's very inevitable for people because they have to work, maybe some people are working for US timings in India or some other European countries, and they have to adjust their sleep clock. So people who have erratic sleep pattern over a number of years because of whatever reason are at risk of having significant sleep problems later in life. But I understand that some people it's inevitable, although our body has that adaptability, our mind has that adaptability skill to some extent. But in some sensitive people, if there are other vulnerable factors in their life, they should really take it seriously and adjust their clock. So let's go to the next concern. But I have to sleep for at least 7 hours. If not, how do I manage my day? So a lot of people have concerns about how many hours they sleep and how much sleep do we need. I think that's a very common question, very common concern people come up with. Some people have this notion of wanting to sleep 8 to 9 hours. If not, they cannot function. Some people are managing with less hours and still perfectly function well. So what does the science say? And there's another concern I'm associating this with. Yeah, this is another concern a lot of people ask me. Can I sleep in the afternoon? Can I have a small nap in the afternoon? Are they okay? Let's see. So let's talk about normal sleep. And let's start with how many hours we need to sleep. Now, I put it has 60 to 66 hours here. Don't get scared. I'm not expecting all of you to sleep for 16 hours. What I'm referring to here is a newborn baby on day one. On day one, a newborn baby sleeps anywhere between 16 to 20 hours. As the baby grows older and older, let's say a day later, not even a week, a day later it starts to sleep a little less maybe, and a week later it reduces further, a month later it reduces further, so a year later it goes down further. So as we grow older and older, our sleep duration keeps going down. So for a normal working age adult population, I guess most of you belong to that category, you probably will need about 6 to 8 hours of sleep. Of course, there will be some outliers. Then maybe there are people who sleep more than 8 hours, like 9 hours, 10 hours consistently, and there are people who consistently sleep less than 6 hours and still perfectly function well. Yes, there are outliers. It doesn't mean that they have some problem, but for some people, if they sleep less or sleep more and have significant impact on their functioning, then that could be a sleep disorder. So like I said, there's an age-related decline in the duration. And like I said, 6 to 8 hours is what we need, working age adult population, some exception of outliers. And sleep latency. So what is sleep latency? Sleep latency is the time between, the time you put your head on the pillow to falling asleep. So technically it should be somewhere between 8 to 20, but there are people like me who's, go to sleep within 2 minutes of going to bed. And there are people who may take longer than 20 minutes. I know I'm also making sure that people don't have their mobile phones or is on social media watching something on the devices. That should be taken care here. So if you keep aside all those things and go to bed, switch off the lights, create a quiet and dark environment, and then if you take more than 20 minutes, that could be insomnia. So now what about naps? 15 minutes of naps in the daytime is equal to about 1 hour of night sleep. So I follow simple principle for people who ask me is afternoon naps okay? I tell them, look, afternoon naps are only for people who can sleep well in the night because they can afford to. If your night sleep is already disrupted, your afternoon sleep will only make it worse. Why? Because 15 minutes of nap is almost equal to 1 hour. Why? Because in the afternoon you are likely to go into REM sleep right away. I'll come to the REM and NREM sleep in a minute, but the REM sleep is a lot more refreshing, and in the night to get into the first REM sleep you may take about 90 minutes. So if you have this nap in the afternoon, that can really take away 1 hour of night sleep. So it doesn't mean that you can't have a nap in the afternoon. Yes, if you're very exhausted, tired, occasionally you can, and as long as it doesn't affect your night sleep. And there's always increasing tendency to sleep and diminished functioning between 2 to 6 a.m. and 2 to 4 p.m. So this is the graph. It shows the sleep over lifetime. As I told you earlier, there is a gradual decline in the duration we sleep. So as you can see in this graph, it starts from day one, where newborn baby can sleep anywhere between 16 hours up to 20, and as they grow older, the sleep duration keeps coming down. Look at the last, the point there where somebody is 70 to 85-year-old, they can only sleep maybe for about 5 to 6 hours. So if you have any elderly people at home, then I get a lot of these elderly people coming into my clinic and saying, doctor, I can't sleep more than 5 hours, 6 hours, and I'm not happy with it. And we call it sleep state misperception, because whatever amount of sleep your body requires, they might be getting. It's just that they're not happy about it. So all I need to do with those people is to counsel them, reassure them, and tell them, look, I think it's good enough. Don't worry, as long as you're functioning well, it's a perfectly normal physiology for you to get only 5 to 6 hours of sleep at this age, because they're so used to sleeping longer hours during their working hours, and also they're now retired and at home and don't know what to do. They come with this significant dissatisfaction about the sleep. So all they need is a little bit of counseling and reassurance. So another interesting thing I want you to notice in this particular graph is the division of REM and NREM sleep, the proportion, the quantity of REM and NREM. The newborn baby has almost 50% of REM is to 50% NREM sleep. So REM, to put it simple, it's like a dreamy sleep. It's almost like you're half awake, where mind is very active, and this is the stage of sleep where you might recall your dreams, or you are likely to recall your dreams. Now, as we go older and older, yes, the sleep duration comes down, but the REM sleep duration comes down significantly also. So an elderly person, when they are sleeping for 5 to 6 hours, it's only a small proportion of that is REM, maybe about 5 to 10%, but in a baby, it's 50-50. So which means newborns could be dreaming a lot. It's so unfortunate that they can't come and explain to you what they dreamt of, but you may have seen some, very cute and weird, experiences, or some, expressions on the face of newborn babies. They're smiling and suddenly they go into some frowning mode, or some, anger mode and all that when you're asleep. I think those things could be just a manifestation of their dreams, because they spend a lot of time in the dreamy state. So it's quite fascinating, actually. Now, how do you prevent the naps? Like, yes, it's okay for me to say that afternoon naps are not advisable, particularly if you're having sleep problems. But for people working from home, and sometimes they end up feeling very exhausted, tired, and fall into naps. And if your night sleep is disrupted, you should try and avoid it. So make sure that first of all you have adequate sleep in the night. If you're not sleeping well in the night, yes, you could feel very tired and drowsy, and it could lead to a further vicious cycle of you having naps and further sleeping less in the night. So sit at a place reserved for working only. You need to set up things at home. If you're working from home, make sure you create like an office space where you get a little serious about your concentration, the way you sit, the way you carry out your work and all that. Make sure you hydrate yourself well. Make sure it's very, well illuminated. Again, and like I already told you, the light plays an important aspect. When there is bright light, the melatonin suppression happens, and you're likely to be awake. Take short breaks in every 40 to 50 minutes and do some stretching or walking exercise, and take few steps and all that. And yes, like I said earlier, power naps are fine but should not exceed 30 minutes, only occasionally when you are too exhausted. So next concern, I can achieve my daily quota of sleep but not in a stretch. So I think this is one of my quiz questions as well. So as long as I get my quota of 6 to 8 hours, doesn't matter what time I sleep or have in, bits and pieces, like maybe sleep for 3 hours in the day, and maybe early morning I sleep 2 hours, and again in the evening I get another 2 hours, I get 7 hours. Is that okay? Another thing, dreams are great, but they are hijacking my night. A lot of people come and tell me, doctor, I just can't rest my mind. The whole night I've been dreaming. Right? And some people start interpreting the dreams and ask me questions about what does this mean, what does this dream mean, that dream mean, and all that. So first of all, let's understand the physiology behind the dream and why we dream and what happens in the body and the mind at that time. Is it normal? Is it abnormal? So I think this graph should, this slide should explain to you, everything. So first, let's understand that when we sleep in the night and wake up in the morning, it's not just one type of physiological activity happening. What we go through in the night is what we call sleep cycles. There are several cycles. In working age adult population who require 6 to 8 hours of sleep, it is about 4 to 6 cycles. And each cycle should last anywhere between 90 to 120 minutes, but generally about 90 minutes. So we go through what we call sleep cycles, each cycle lasting for 90 minutes. And within that sleep cycle, each cycle, there are further different stages, REM and NREM. REM stands for rapid eye movement, NREM stands for non-rapid eye movement stage. So yes, eye movement will be rapid. At the same time, there are many other physiological activities also happening. So I really don't want to go into the details, but just to help you understand, all the stages of sleep are equally important, but they have their own unique physiological mechanisms and unique benefits, from this type of sleep we get in those stages. So in if you actually look at some of the explanation I've given there for example, NREM has 3 stages, stage 1, 2, 3. Stage 3 is the deepest sleep, NREM stage. And we spend a lot of time in stage 2 actually. About 50% of our sleep will be in stage 2. And stage 1 is about 5 to 10%, and REM and stage 3, that's a deep sleep, is about 20 to 25%. So stage 1 is like a transition between awake and going to sleep. It's very light sleep. So here, eye and muscle movement would be there. And in stage 2, eye movements actually stop and heart rate slows down a little. So as we go deeper and deeper into sleep, our heart starts to slow down and brain waves also slow down. In the deep sleep, if you look at stage 3, so it's very difficult to wake people up in that stage that have a very slow brain waves at that time. Now, what happens in REM? REM, like I said, it's almost like a half awake stage, right? So this is the stage where we actually start recalling all our dreams. So there's a theory that we might be dreaming the entire night, but we don't recall it. We only probably recall the dreams dreamt in REM stage. And look at the right hand bottom corner of this slide. where I have put a graph thing that's called hypnogram. That's actually plotting of your sleep of different stages the entire night. A typical sleep hypnogram looks like this. So actually it's pretty easy to interpret. It may look a little complex. Basically we are plotting the NREM stage 1, 2, 3 and REM sleep in terms of how much duration you actually spent on. So each spike there represents a cycle, sleep cycle. And within that each spike you see that thick, I don't know if I have a marker here, pointer. So yeah, anyway, so I don't know if you can see that the thick blocks of at the top of these spikes here, they are the REM stage. So as you can see, these thick blocks in each cycle, as the night progresses, as you move to the next cycles of sleep, this REM proportion gets longer and longer. So in the last sleep cycle of your sleep, in the early morning, the majority of the sleep is in REM sleep. So you may have heard about in Indian culture, we talk about early morning dreams coming true. I don't know about that, but what we do know is we tend to recall dreams dreamt in the morning a lot because we spend most of the mornings in REM sleep. So there's a possibility that we are dreaming the entire night, but like I said, since REM sleep is a half awake stage, we tend to recall the dreams dreamt in REM. In REM dreams, maybe there are dreams, but we may not recall it. So another beauty about REM sleep is actually, all our body muscles are paralyzed. Now, if you look at that small box next to the REM stage in the left-hand top box there, this describing the REM stage, dreams occur, eye movement is faster, brain activity increases, heart rate and blood pressure increase, arms and legs muscles are paralyzed. Our body is almost paralyzed. And that's also probably a protective mechanism which the nature has provided. So you're actually dreaming so much in REM sleep. Imagine if you're not paralyzed. I think you'll start acting upon your dreams, and you'll make all sorts of weird things, probably, running away, dancing, hitting people. I don't know, whatever you dream, you may act upon it. So God has created this beautiful paralysis so that we don't act upon your dreams. We can quite, calmly just lie down, relax, and just experience the dream as a movie. But in some people, they may not have this paralysis and actually start acting upon it. We will come to that when we talk about disorders. So this is the sleep cycles. So I think it explains to why it's important to sleep in one stretch, because we go through several important stages of sleep and several back-to-back cycles to give you that refreshing sleep in the morning. And it does not happen if you sleep in bits and pieces. You can't break your cycle to 1.5 cycle in the night and then continue in the daytime. No, it doesn't happen, because daytime you may not follow the same physiology, because the body hormones are different. You don't have melatonin, and you are dealing with so many other things during the day. So your pattern will be all over the place, very erratic. You may end up going to REM sleep straight, right away, and feel refreshed within 15 minutes. And again, that would affect your night sleep. So again, I like this sort of definition, the definition of a REM and NREM. It's put quite simple in simple terms and beautifully. NREM is an idling brain in a moving body, and REM, an active hallucinating brain in a paralyzed body. Like I said, in REM sleep, body is paralyzed, but mind will be super active. It will be in all kind of fantasy, dreamy stage. In NREM, it's exactly opposite. It's an idling brain, or at least that's what we think, because we don't know, in a moving body. So you might be tossing and turning in the night. That happens usually in the NREM stage. So next concern. It's terrifying in a quiet home at night when everyone's asleep and I am not. This is quite nightmarish. A lot of people come and tell me, look, I keep fighting with my sleep. It's very nightmarish, when I can't sleep, I keep fighting within myself. I get so desperate, so anxious, thoughts are all over the place, and I just can't sleep. It's terrifying because everyone's asleep at home and it's quiet. And why does it happen? So a lot of people, for whatever reason, they may have had a couple of sleepless nights. Typically, for example, a couple of days ago, I had a patient who said, she's not been sleeping for almost 3 years now. It started with COVID. She had COVID positive. She was admitted in a hospital, quite serious. Saturation was coming down. She was terrified, quite anxious. She thought she would not make it and she would die, and that kept her awake. She couldn't sleep in the hospital ICU. Luckily, she recovered from COVID, but what she's left with now is a chronic insomnia. So whatever set off her sleep problem is gone. The COVID is fine now. She is recovered pretty well from COVID, no problems at all. But however, her anxiety is maintaining her insomnia now for 3 years now. It's a very, very common phenomenon. And to be honest, 70 to 80% of people who have insomnia will have, some anxiety or psychological issues, particularly people with chronic insomnia. And why is that? That's because, when you start sleeping less for whatever reason, you start developing anxiety. You start developing anxiety about sleep. We call it, anticipatory anxiety. You start worrying about, oh, will I get sleep tonight or not? If I don't sleep well tonight, how do I manage my following day? That anxiety itself will further reduce your sleep. And the less you sleep, the more the anxiety, the less you sleep, and you get trapped in that. So I see lots and lots and lots of people with chronic insomnia have this typical problem. Yes, there may have been different causes why they started with insomnia to begin with, but however, what's maintaining their insomnia would be just purely anxiety. And before coming to me, they would have gone to several, doctors and tried different things, sleeping tablets and following all the sleep hygiene. A lot of people come and tell me, doctor, I follow all the sleep hygiene very religiously, still I can't sleep. The first thing I tell them is, can we just accept that it's okay, even if you don't get perfect sleep every night, and that happens probably to everyone. So we teach them some techniques of managing their anxiety, not just focusing on insomnia, but looking at their anxiety levels. Snoring means sound and deep sleep, right? So that's another thing people assume or conclude, and people even ask me about this. I don't know what you guys think. I wish in interactive session I would have asked you guys. But so what snoring means, it's actually a manifestation of something going wrong. It's actually a mechanical problem. Snoring does not mean sound and deep sleep. It's anything but. So what's happening? Well, you hear somebody snoring and you think they are in sound and deep sleep, but not the case. You ask people who snore excessively, they'll tell you that during the day they feel very lethargic, very tired, they're very sleepy, irritable. They may even fall off asleep wherever, and all these problems they have. And usually it happens to males in middle age and who are little overweight. So what they're actually going through is blockage in their airway. And when we are asleep in the night, particularly in REM sleep, now you know that REM sleep, all the muscle paralysis happens, right? So when that happens, all the muscles around the neck, particularly in people with overweight, obesity, including the tongue, they fall back. They fall back, and when they're in paralysis, they block the airway. When they block the airway, the air can't enter in, the air pressure starts going down, leading to reduced oxygen concentration. Actually, the desaturation happens, and that will create panic on the heart. The heart starts to panic because there's not enough oxygen to supply to the body, and it starts to beat faster. Blood pressure goes up, and people do develop hypertension because of this particular problem. And people may even put on weight and develop all the consequences of hypertension, like high cholesterol, and even people having heart attack. A lot of people you may have heard about, going to bed in the night, but they never woke up in the morning. Right? And you may wonder what happened to them. Is it a heart attack? Is it cardiac arrest? What happened? A lot of those people may be having this condition called sleep apnea. So this is what we call it. Sleep apnea is the term for this condition where people have excessive snoring. So what is sleep apnea? Sleep apnea, yes, it is sleep-related breathing disorder. People have excessive snoring. Not just snoring, they may even have pauses in breathing. They may have short pauses in breathing, which can be quite scary for the people sleeping next to them. Shortness of breath. Like I said earlier, they may have a lot of daytime sleepiness, tiredness, lethargy, cognitive impairment. So what basically happens? Partial blockade of airway and lowered oxygen concentration, like I said, resulting in sleep disruption. So people with sleep apnea, the brain cannot get into deep sleep, because the moment the brain tries to go to deep sleep, because of lack of oxygen and the panic that created in the body, the brain keeps waking up. Yes, sleep disruption is okay, but it also has serious metabolic and cardiac consequences, like I already said. So somebody is snoring heavily, they need immediate attention. So how do we treat it? There are mechanisms where we treat sleep apnea with a device called CPAP, continuous positive airway pressure, or if there are any other underlying cause, we'll treat it. Of course, we encourage the person to lose weight and get fit and all that. That definitely helps. Next concern, how can my food habits help my sleep? and exercise surely helps, right? Now let's go through few sleep hygiene techniques. With this concerns in the context, let's go through some sleep hygiene techniques in terms of how do you get your sleep better. So what are the sleep hygiene techniques you should be aware of? First of all, let's start with food. Yes, before you sleep, high tryptophan snack, which is an amino acid required for all our proteins and metabolisms in the body, including our serotonins and melatonins. So you can have high tryptophan snack. So basically anything like pulses, cereals, fruits, milk. In the Indian tradition, we have the habit of encouraging our children to drink a glass of warm milk before they go to bed, or eat a banana, grapes. All those things have high tryptophan and melatonin, serotonin, which definitely helps in sleep. And some people have the habit of taking warm bath, about 2 hours before bed. And the same with food also. So the time between your last meal and the sleep should be about 2 hours. So if not, even simple things like acidity can keep you awake in the night. So some people may have chronic sleep problem, but if you actually investigate, it's the simple acidity, the reflux that causes their insomnia. So exercise should be done. Yes, exercise definitely helps at least 30 to 45 minutes, but preferably in the daytime, because nighttime rigorous exercise closer to bedtime can be counterproductive. Nowadays, we see all the gyms open like 24 hours a day, but certainly not advisable, because you're actually stimulating your brain with, your adrenaline goes up, and that can keep you awake in the night, and certainly not advised. Of course, smoking can also be quite stimulating. So no smoking 2 hours prior to bedtime. We all know the caffeine impact. So excessive coffee, tea can, particularly in the evenings, for people already having sleep disorders or sleep issues, not encouraged at all. So yeah, a lot of people do all sorts of activities on sleep in the bed. So please associate your bed only for sleep. Do not take your work or book to your bed. A lot of people open their gadgets, start watching movies and chatting away with people, social media. So you cannot associate those things with bed. Do not watch TV while in bed. If you're trying to sleep and are not asleep for after 20-30 minutes, you can get up, go to your desk, switch on the dim light, and start reading from a book or listen to a soothing music. That you can do. Like I said, yes, it's okay to eat early, but again, don't go to bed hungry. Of course, you can't go with a heavy tummy as well, because that can cause reflux. And a lot of people have this habit of watching the clock when they're not able to sleep. Again, we talked about the anticipatory anxiety that it increases stress. If you get desperate about sleep, it actually worsens your sleep. So you need to go to bed in a relaxed state and telling yourself, you know what, whatever amount of sleep I get, I'll manage it, right? So try to work around it. Don't work against it. Don't fight with it. So try to calm yourself down. And thoughts should be relaxing and pleasant while trying to sleep. So get into some nice thoughts or focus on your breathing, so do some deep breathing exercise and all that. So we already talked about the importance of light and darkness in the context of melatonin. So strong light like sunlight is a powerful regulator of a body clock. So it inhibits the production of melatonin and interferes with sleep. So particularly people working in the night shift, they should make sure that they actually create a dark environment when they are trying to sleep in the day. Use curtains and blinds to cut off natural light. Use dim light if necessary. Some people use eye shades, and if you're returning home from night shift, yeah, you can wear dark glasses, because the sunlight might start preventing the release of melatonin and stimulate your brain. So already spoke about television and books. So no TV. Yes, for books if you're struggling to sleep for longer. So what about popping an anxiety or rest pill to sleep better? People often talk about sleeping tablets, and some people have the habit of using sleeping tablets. And we all know the effect of these sleeping tablets. Me being a sleep disorder specialist, I actually don't prescribe these medicines to anyone. Occasionally, if there are any anxiety related issues for a short term, I might prescribe. But however, a lot of people go to the general practitioners and just push them to prescribe these things and go to medical stores and buy it. Of course, it's illegal to issue these medicines without prescription, but still some people get hold of these things. So on these tranquilizers and sleep medicines need to be taken under medical supervision only, as majority of them could be addiction forming. And some people we do prescribe, but not more than 2 weeks. And there are some medicines which will not be very addictive, like melatonin, zolpidem, but even that cannot be taken without consulting a doctor. So I see lots and lots of people who are addicted to these sleeping tablets. So very, very often, and many doctors also, I say recently we saw a doctor from a different part of the country, so a surgeon rather. He was so addicted to the sleeping tablets, zolpidem. He was using like literally about 200 to 300 tablets every single day. And with that one tablet of whatever he was taking could knock me out for a couple of days, I think, if I use it. But he was using literally 200, 300 tablets, and he takes them in a very staggered manner. He wakes up in the morning, takes about 10, 15 of them. Couple of hours later, he takes another 20, 20, 30, and he does it through the day. And he's still walking around like any of us, completely, awake and all that. And so yeah, eventually his mother, who is also a doctor, brought him to our hospital, admitted, and we had to treat his underlying cause and also detox him with this sleep medicine addiction. So we see that quite a lot. Another thing is, with these medication, it can affect your cognition. It is not just the addiction, it can make you forgetful, it can affect your concentration, your problem solving skills, your executive skills, and also make you quite unstable on your feet. So people try and use all other methods like alcohol, many drugs and smoke, cigarettes to help sleep. But again, alcohol, please understand, it is a depressant in itself. All these substances have larger negative consequences, not just on sleep, but on the mental health, the physical health, and so on. So please do not look for an easy answer. You have to take a step back, look at the underlying cause, and treat the cause. So last 5 minutes, I want to just spend on talking about sleep disorders. So far, we spoke about the concerns related to sleep, the normal sleep, and all that, and sleep hygiene. But now let's look at little clinical disorders just for your information. So although there are many disorders related to sleep, there can be only 3 complaints related to sleep. Either you sleep less, or you sleep more, or something abnormal happens during sleep. So sleeping less is insomnia, sleeping more is called hypersomnia, and the abnormal activities or experiences that can happen during sleep include that big list there. I'm sure you heard some of it: sleepwalking, sleep talking, nightmares, night terrors, movement problems, and bruxism. Bruxism is basically teeth grinding, bedwetting, and so on. So insomnia is, like I said, it's the most terrifying thing. Anything can be insomnia. There are actually 4 subtypes: difficulty in initiating sleep, or some people go to bed, they fall asleep straight away, but they keep waking up in between. Maintaining sleep is a problem. Some people neither have problem getting into sleep, nor they wake up in between, but they wake up like 3 a.m., 4 a.m., early morning awakening. After that, they can't get back to sleep. In some people, they don't have all these 3 problems. They can easily go to bed, they sleep through the night, they wake up in the morning when they are supposed to, but they don't feel fresh at all. All those 4 things can be insomnia. Very common, rather 30 to 40% of people have suffered from insomnia at some point in their life, 10% of them being chronic, like for few weeks to few months. Very common in elderly females, people who are not married, divorced, or separated, probably because of the psychological issues. So what causes disrupted sleep or insomnia? There can be external factors. We first look at the kind of environment they sleep in, the noise levels, the temperature, the type of mattress they sleep on, and so on. And internal, then we look at the probable internal factors like psychological cause, anxiety, depression, physiological causes, like I said, simple things like acidity, asthma, migraine, headache, diabetes, hypertension, everything can affect sleep architecture. So basically, we look at the underlying cause and see how we can treat the cause. Quickly, like insomnia, we see a lot of people having excessive sleepiness. They sleep well in the night, all right, but they also have excessive sleepiness during the day. So they may be going through, if somebody is sleeping excessively during the day, the first thing you need to rule out is, are they sleeping well in the night? Are they suffering from insomnia? And it could be secondary to some other problem like parasomnias in the night, all those sleep talking, sleepwalking, and all those nightmares. So if they're having those problems, not having adequate sleep in the night could result in excessive sleepiness. There's a condition called narcolepsy where people just fall asleep whenever they're idle, and sometimes they get into collapsing, like literally fainting when they go through significant emotions like laughter or crying. It's a particular condition where their body, when there's idle, it gets straight into REM sleep. It's quite rare, but can happen. Sometimes excessive medication could lead to hypersomnia. some medical conditions like Parkinson's, neurodegenerative condition, head injury, psychiatric conditions like depression, schizophrenia, excessive use of alcohol, drugs. So basically, we look at the underlying causes of excessive sleepiness and treat the cause. So other sleep disorders, apart from insomnia, hypersomnia, like I said, circadian rhythm disorders, there's a mismatch between circadian rhythm and the schedule of the person. Like these people going to sleep at 3 a.m. regularly and waking up like 11 a.m. in the morning, or it could be other way around, sleeping early and waking up early also. Parasomnia, like I already told it, the abnormal thing that can happen in the night when they're asleep, like movements, behavior, acting upon their dreams. Crimes can be committed in the sleep. People, I have come across people who have gone to the court and claiming that they have some sleep disorder and they can't remember what they did, if they've been charged with some murder or rape and things like that. Of course, we do an extensive analysis, assessment of the sleep, including the polysomnography study, and to understand if the person is actually making it up, or do they really have problems. Sleepwalking, sleep talking, night terrors, nightmares, quite common. Teeth grinding, movement disorders. So basically, any of these disorders people go through, we basically look at the underlying causes. For example, these movement disorders, the cause could be something organic. People, particularly females, it's very common. Iron deficiency, so hence very common in pregnants. Sometimes thyroid deficiency, vitamin deficiency, all these things can cause movement issues. And there are many other conditions like chronic pain, fibromyalgia, headaches, psychiatric conditions like anxiety, depression, medical conditions like I already mentioned, reflux and other, conditions, people with substance misuse, and sometimes it could be just the environmental factors. So when to consult a doctor? So anybody sleep disturbance for at least 3 days in a week for at least 2 weeks and affecting your functioning, social functioning or occupational functioning, and associated with some low mood, you may decide to consult a doctor, because many short-term insomnias, they get over naturally, don't need to consult a doctor. Your body has a natural mechanism to catch up on sleep, as long as you follow good sleep hygiene and relax yourself. So what do we do as doctors if somebody comes with sleep disorders? First thing is we address is the expectation and perception. Like I said, many things could be just the reassurance all they need, sleep state misperceptions and things like that. They have a very unrealistic expectation, so we address it. So we take a comprehensive history, understand their sleep habits through maybe sleep diary, or sometimes a lot of technology as they have actigraphy machines, or sometimes people wear the devices like smart watches which can tell us about their sleep quality, quantity, and all that. So we take the history about the medical and psychiatric conditions, substance misuse. We may sometimes ask them to see ENT surgeon or neurological examination, because they may have some anatomical issues affecting their sleep because of sleep apnea and all that. And we use a lot of questionnaire, like I said, sleep diaries, and a sleep study in some people, where we actually admit them in the hospital and do an overnight sleep study with a lot of monitors attached to them, looking at the brain wave, EEG, ECG, EMG, and so on, to actually understand the underlying issue. That's very helpful because it gives a very clear picture in terms of your quality, quantity, and anything abnormal. So how do we go about treating? Basic principle is treat the cause. We just don't treat sleep, we treat the underlying cause. For example, it could be anxiety, it could be sleep apnea, where the treatment could be completely different. So rather than focusing on helping people to sleep better, we look at the underlying cause and treat the cause. Treat any comorbid medical or psychiatric condition, because sleep is probably the most effective psychiatric medication. Treat substance misuse, encourage them with sleep hygiene, lifestyle. I think we have spoken about all these things. Psychological therapy like CBT for people with anxiety, addressing any of their family social factors. Maybe they are taking medication which could be directly affecting their sleep and so on. So just to quickly summarize, sleep is a very complex phenomenon involving physical, psychological, social, personality, and other factors. You don't have to worry about all those things, but the body and mind takes care of these things. You just have to relax and just go to bed and not fight with your sleep. Good sleep is essential for optimum functioning of our mind, body, performance, and social life. Disorders can result in significant impact on those factors. And what we do is a comprehensive assessment to understand the underlying cause and to determine appropriate treatment. All you need to do is consistent and simple sleep hygiene techniques to resolve some of the most common problems related to sleep, and you don't have to consult a sleep specialist for everything.
Excellent. Doc, I can't thank you enough. I think you have a knack for simplifying the concepts, which have sound initially very complicated, but making it very understandable for us all laymen. I think we can't stress enough on the importance of paying attention to your overall quality of sleep and quality of life and how it's impacting you. How can people reach you?
Yeah, I mean, we can send out our. I'm a consultant at Marga, which is a psychiatric hospital in Yelahanka, Bangalore. So we can visit our website margamindcare.com, or you can email me at Dr. Satish, that is DrSatish. You can if somebody can type in the chat box or chat box, you can feel so. Feel free, Dr. Satish at peopletreehospitals.com. So.
And what is the website again?
It is margamindcare.com. MAARGA. You can see on my slide.
Yeah.
Mindcare.com.
Yeah. Are you, do you have any other resources on YouTube, social media, etc., where you put up anything that people can have further readings on?
Yeah, I think if you type my name, I'm sure you'll find lots of YouTube videos which have been done by various media people and all that. And I'm not a very tech savvy person, not a very social media savvy person, but I'm trying to be. But yes, I have all those social media handles and also Marga Mindcare also we can find. So you can search for me, and YouTube also can type my name. I have several videos. So I'll try to put out more.
Yes, I think absolutely. You need to put out the important message more and more so that we are all educated. Thank you once again, Doctor. Wonderful having you with us. And thank you to all the attendees. A lot of you have stayed back well beyond the time. I will now conclude the session. I wish all of you a very happy weekend.
Thank you very much. Thank you for the opportunity. Thank you.